tonight.
I started smoking because I thought it was cool. During the night, I would wake up with this strangling cough.
She had the most common lung cancer, adenocarcinoma.
An ABC 27 special presentation.
I was experiencing breathing problems. Any uphill walking was tough. My grandfather also had a heart problem. I expected that I wouldn't make it too much longer because it was getting pretty profound.
Penn State Hershey Heart and Vascular Institute presents Heart to Heart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. Heart disease and lung cancer are both leading causes of death among men and women in the United States. Every year, about 935,000 Americans have a heart attack. Cigarette smoking is the leading cause of lung cancer. 85% of lung cancer patients have a history of smoking. The American Cancer Society says about 3,000 non-smoking adults die per year from breathing secondhand smoke. Tonight, specialists from Penn State Hershey Heart and Vascular Institute are in the ABC 27 call center to answer your questions. Call the number on the bottom of the screen, or you can email your question during the show to questions@abc27.com. Dr. Michael Pfeiffer will answer your emails throughout tonight's show, and keep in mind all calls and emails are confidential. We begin tonight with Deborah Pinkerton sharing one of our patients' stories. Deborah?
Thanks, Chuck. A Mechanicsburg woman couldn't believe a bad habit she had 20-some years ago came back to haunt her. Now she's on a mission.
Don't play with the cigarettes. Don't put them in your mouth.
Wise words spoken from 67-year-old Shirley Hobbs. She wishes someone would have given her that advice when she was a teenager.
I remember starting when I was age 14. I started smoking because one reason was because I thought it would keep me warm in the wintertime when I was out waiting for the trolley for school. The other reason is because a lot of members of my family smoked.
After graduation, Shirley's smoking increased.
In my 20s, I started smoking maybe 2 packs a day. I couldn't have a conversation with anybody unless I had a cigarette. I would get up in the middle of the night to get a cigarette. The phone rang, I had to get the cigarette first.
Shirley's 4 children were young at the time, but were well aware of her habit.
In those days, I always remember Mom with a cigarette in her hand, or a cigarette in her mouth.
Growing up in a situation where you can actually smell the smoke was a different story. It wasn't anything pleasant for us, but it was something that we had to get used to.
As a kid, I remember being in children's church. I would, and they would have like little testimony for the kids. In prayer requests, I would always get up and say, pray for my mom that she stopped smoking.
Antoinette's prayers paid off. After 30 years of smoking, Shirley quit.
I cannot tell you why or how I stopped. I went to work, I worked all day. 6 o'clock, I went to my mother's house. All of a sudden it dawned on me, I did not have a cigarette.
After, a few days, and she's still not smoking, and then those days turned to weeks, and weeks turned into months, and, before you know it was years.
We were all shocked. I mean, she went from a chain smoker to just stopping.
Shirley stopped, but the damage was done. Damage that wouldn't be revealed until 20 years later when Shirley got sick.
I had this cough where it was like a strangling cough, and it was always a tickling. I thought it was allergies or something.
A CT scan revealed something different.
Shirley came to us with the diagnosis of a pulmonary nodule. The right lung had a little bit of a shadow in it in the upper lobe. And this could easily be a little spot of pneumonia or inflammation, and we would expect that it would go away.
The plan was to follow the nodule.
We went every 6 months for about a year and a half. And finally, I'm sorry. They ordered biopsy.
It had changed in size by just a few millimeters. It was very subtle. but started to get a little bit more solid looking. Right there are some warning signs that you might be dealing with a lung cancer.
Doctors were right. Shirley had lung cancer.
I didn't shed a tear, honestly. I made that determination within that hour. Cancer would not take me.
She had the most common adenocarcinoma, and so that has different stages, and the earliest is a small nodule. So hers was about a centimeter. At a centimeter, there are 1 billion cancer cells. As long as that hasn't spread anyplace else, that's still stage 1.
The first thing you think about when they say cancer is death, a painful death.
I just couldn't grab the fact that it was my mother that they were using in the sentence with lung cancer.
It was devastating. I mean, I don't know if you can prepare for that answer, but it came as a result of the smoking. And we did what we always do. We pulled together as a family. We pray about it. We solicit prayers.
So if you take out a stage 1 lung cancer and you get it out before it spreads, you have between a 60 and 80% chance of cure.
Dr. Lazar said, you pick a date and we'll do the surgery. I picked the 16th of February. That was my mother's birthday. And he says, fine. He said, now you got 2 angels watching over you, God and my mother.
The date was set. Shirley and her family were ready.
I had my #1 gear, and that was my children, my family. I wanted to see all my grandchildren grow up.
She had a right upper and middle lobectomy. We started off with the robotic approach. So the robot's excellent because it's a great camera, it's in 3D, and you can really see the anatomy very well. So we isolated the arteries and veins that go to the middle and upper lobes of her lung. But to get the main portions of her lung tissue stapled off safely and around the tumor, we had to make the incision a couple centimeters bigger so that we can get big staplers in there to seal off the lung on both sides.
And then when I woke up, I saw my daughter and my sister Brenda. But I knew I had survived. I knew I had beat cancer.
To watch her come out of that, you know, because at the end of the day, she has to deal with that, you know, and to watch her just go through it and come out basically unscathed is a miracle.
Hi, everybody. We just heard from my doctor. We got the results back from my surgery. There is no cancer nowhere.
Now Shirley tells her survival story to anyone who is willing to listen.
I'm trying to educate people about smoking, the dangers of smoking, wake their minds up. You know, this is nothing cute, this is nothing nice. This is cancer that you're picking at.
A strong message that resonates loudly. Her children couldn't be more proud of her.
Most people feel like they have the best mom in the world, but I really, really feel that.
Usually the parent is the one that's proud of their children, but here we're proud of our mom.
Keep up the good work, Mom.
Wait, who got it?
As you could see, a very close family who all pulled together for their mom. Because Shirley's lung cancer was caught early, she did not need radiation or chemotherapy. Chuck, back to you.
Thank you, Deborah. That's a good story to see that happening. Now, joining us on the set is Dr. Michael Reed, cardiothoracic surgeon. Doctor, let's begin with the basic. What is thoracic surgery?
It's surgery of the thorax, which is the chest. It's actually a combination of 3 distinct entities: adult cardiac surgery, surgery of the heart; pediatric cardiac surgery, which focuses on children's heart ailments; and then general thoracic surgery, which I do, which focuses on the surgical care of both benign and malignant diseases of the chest, including the lungs, the esophagus, and other organs.
All right, tell me about, let's talk about just generally, how has thoracic surgery, how's that changed in recent years?
Well, if you've heard already, the real great story of thoracic surgery is the increased use of minimally invasive approaches. So what used to be big incisions for significant operations, you can still perform the operation now, but through smaller incisions.
Okay, so is that faster recovery time? Is that one of the reasons?
Absolutely. So, of course, there's a cosmetic benefit, but by using video assistance and robotic techniques, with the small incisions, people have less pain. Less pain is wonderful, it's humane, but it also allows you to return to activity, return to work, and if additional therapy is necessary, you can get those treatments earlier.
That's right. And we talk about many shows we do here with the Hershey Med Center, they talk about multidisciplinary care. There has to be a lot of pluses to that. Talk about how that works.
Well, the Heart and Vascular Institute, our principle is multidisciplinary care, and it applies throughout the medical center. The concept is that the optimal delivery of healthcare is by a team of experts in a variety of specialties. For example, in lung cancers we've heard about, it might include thoracic surgeons, interventional pulmonologists, perhaps oncologists, radiation oncologists, all working together and communicating.
So it saves a lot of time, one stop, so to speak.
One stop, efficiency, and we're all working together.
Excellent. Thank you, Doctor, for joining us here tonight. And at this point, we're going to check back into the ABC 27 call center. Deborah Pinkerton. Deb, it looks like it's very busy over there tonight.
Chuck, it is very busy. The phone lines are busy. The number to call once again is 717-346-3333. Now, here to answer our viewer questions this evening is cardiologist Dr. Stephen Ettinger. Thanks for being with us.
Good evening. Thank you for having us.
This is our first question. Both of my parents died from heart attacks. I get blood work regularly to watch my cholesterol and triglycerides. Can you explain what to look for? How does this put me at risk for heart disease?
Certainly, in anyone who has heart disease, we look at their total cholesterol, which should be within a 200 range. The bad cholesterol, or LDL, should be within the 70 range. And the good cholesterol, or HDL, should be at least 40 in a man and 50 in a woman. As far as assessing risk factors, I would encourage this patient to talk to the healthcare provider because certainly other things such as smoking, diabetes, hypertension, sedentary lifestyle measure in the equation.
Okay, great. Thanks so much, and we will talk to you a little bit later. So stay with us. We will be right back.